Hi everyone, my name is Antony. I'm a community manager at Medic. I'll be presenting this section with Bernard, who is one of our community developers. We could move to the next slide. Yeah, so our presentation is on the enhancements we have made in CHT to enable interoperability workflows in Zanzibar. And I'll start off by providing some background about the existing systems. So in Zanzibar, the Ministry of Health has been working quite closely with partners and also a couple of stakeholders to digitize a couple of health services. And this is just to promote universal health coverage and make sure that everyone can be able to access care wherever they are. So the critical core platform supporting the healthcare system in Zanzibar are three. We usually have the Jamini Afya app, which is the application that's used in the community setting. So CHW use that application to deliver community healthcare services to the communities they support. And also within the community, we have the kadi ya matibabu. That's a Swahili word for a health card. So community members and specifically household and household members are registered in the kadi ya matibabu. And the reason for that is once you are registered, you are provided with a health card. And that health card has a unique identifier which can be used to identify you across different healthcare system. And then in the facility setting, we have various EMR that are used. And within this EMR, they also use the unique identifier to identify clients across the different EMR. So what the Zanzibar Ministry of Health have been able to work on, working with a couple of partners, is to be able to build an interoperability layer so that we have a standard way of information being shared across the different systems. So just to repeat that, in the community, we have two applications, Jamini Afya. Jamini Afya is used to provide community care services. And then the Kadi ya Matibabu, which is powered by the Open IMI system, which is also a digital public good, is used to register clients so that they are provided with a unique identifier. So if you are a CHW working in Zanzibar, you're expected to have two applications on the same device, which is also a gap. So despite that challenge, there has been a lot of achievements with the interoperability workflow. So for example, it's possible to share information from the community to the facility. So it's possible for CHWs to be able to refer symptomatic clients from the community to the facility. And then it's also possible for discharges to be referred from the facility back to the community so that community care workers can be able to continue to follow up and make sure that those clients continue to improve in their journey or pathway to recovery. So because of this interoperability, it's now possible for CHW to be able to refer under 5 pneumonia suspected cases to the facility, and it's also possible for healthcare facilities to refer confirmed cases of pneumonia for under 5 and refer them back to the facility for continuity of care. Despite all these achievements, there are still challenges. And one of the challenges I had mentioned, we have fragmented workflow. And by that, I mean that CHWs have to do duplicate work because they have to go to the household, register that household in the Jamini Afya app, and that would mean that that household will be registered in the Jamini Afya app, and then also proceed and register the household and household members in the Kadi ya Matibabu system. And that has really overstretched the CHVs and made them to be quite overwhelmed. So in the past few months, the Ministry of Health, working with stakeholders, decided only to have one application in the community setting, just to make sure that the process is more smooth and easier for CHW. And with that decision, it was decided that Jamini Afya will be the app that will be used in the community setting, both to register household and household members in the Jamini Afya program, which is a community health program, and also register households and household members and provide to them the unique identifier using the kadi ya matibabu technology. So for that to be achieved, the system used in the community settings needs to be able to capture, it needs to be able to capture a lot of attachments, including photos, and a lot of information that can be shared across the system. So we could be able to move to the next slide. So to enable CHT to be able to capture a lot of functionalities that kadi ya matibabu was supporting, we were supposed to build a couple of improvements within the CHT. And one of the improvements we have been building is enabling a user to be able to upload attachments for the subcontacts. So just going back and sharing, one of the challenge we had is previously when CHWs were expected to use Jamini Afya, which is CHT, to upload attachments to the subcontacts, the process would be the CHW would be able to register a primary caregiver, and after registering a primary caregiver, they proceed and register household members who are always attached to the household. And then in case a household has like 6 household members, they were expected to go to the profile of each household member and be able to upload the attachments, and the attachments might be photos or some of the attachments that are required for the verification process. So if a household has 6 household members, a CHW was expected to go to each contact and be able to upload the attachment, which was a painful process. So what the ministry required was for the process to be smooth, in that whenever I register a household using the household registration form, I should be able to add within the subcontacts the attachment, so that it's easier for CHW just to use one form or one workflow just to complete the registration of individuals in the Jamini Afya program, and also register individuals and provide to them the unique identifier. So we have been working on these enhancements within CHT to enable uploading of attachments in the subcontacts in CHT with a couple of partners, and that includes D3 and Ssollinc, and also within the community, so that you can be able to enable this capability. So just to share more details regarding this functionality, I will pass over to Bernard, just to share the new functionalities and be able to demo the solution.
If we could move on to the next slide just for a moment. And as we do that, my name is Bernard. I lead the technical implementations at Ssollinc, and we've been a part of the CHT community for a while now. In this case, we're helping build and support this feature alongside others in the community. So there are 2 major features here to highlight that enabled this. And for the demo today, we'll focus on the profile photo, which is just one of the attachments that Antony mentioned. For context, CHT has, for the longest time, supported attachments. So you can attach a photo, an image, a screening result to a report, as well as the contact. The challenge and the problem or the workflow that had been unsupported was where you have child contacts and child documents. Those attachments weren't being written to the correct profile. And so, for example, if you created a household and within it had profile photos, those profile photos will end up in the household as much as you may have intended for them to be attached to the household members. So that first feature, the first bulletin on the screen, is to make sure that the attachments end up in the correct profile. And the second one, which is the more visual part of the demo today, is being able to have that profile show up as part of the profile photo for a contact. We'll proceed on to the demo. If I can share my screen. And hopefully on your screen, you can see my demo CHT screen. This is a typical, thank you. This is your typical CHT, it's a demo instance. And so the workflow I'll demonstrate today is registering a household and attaching a profile photo to each of the household members and view those profile photos against each of the contacts. Here I have the default household form. The only modification I've done here is to add a profile photo field, which is also configured to be the image that we display against the contact, as you'll see. So I'll just proceed on to add a household. So that's the head of the household. I'll skip a lot of the other options here for purposes of a short demo and proceed on to attach a photo. In this case, let me pick that so you can see the image you're attaching. Then proceed on to add two children. So I'll add the daughter and proceed on to add another profile for the son. Then we'll proceed on to save that household. As you'll notice, I have my household created with 3 contacts, Bernard being the head of the household, and as you'll notice, there is a profile photo. If I go back to the children, you'll notice they also have the profile photos attached to the user profiles. So that's as much as this demo is going to go, but it's just what you can see. But behind the scenes, it's all the work to have all the attachments go to each of the profiles. In this case, we're using the profile photo, but you can imagine any other attachment, whether it's a screen or it's, other scenarios you can imagine, they will still end up being attached to each of the profiles you have there. And this also applies to the reports. In this case, we're using the contacts because that's what D3 are keen on for the current deployment. But this functionality is also applicable to where you have child documents and repeated groups. I'll stop there for any questions and back to you.
Thanks, Bernard. It's really kind of amazing to see the face put to the name. I don't know, it makes it seem so much more human and connected with the patient that you're giving care for. It's a wonderful feature. But I wanted to open it up to anyone on the call if there's any questions about the implementation. I'll kick it off, which is when can I use this new feature?
So let me respond to that. We've been doing a lot of the hard work to get this ready for hopefully the next release. We don't have the timeline, but hopefully within the next month, I'd say.
Nitin, do you want to come off mute and go ahead and ask your question there? Okay, so Nitin asks, will it have any effect on the sync time?
So some of the design considerations done were, so let me share my screen again. And to answer your question in short, yes, but not as bad as you'd imagine for attachments. This particular scope didn't attempt to do any processing, just to try reduce the size of the attachments and so on. But some of the design considerations, just to make sure that we don't overload the screen, is that we only load this image when you're viewing the screen. The sync time, yes, because then we need to, in fact, no, I think the attachments we pull at the point of display. Some of the other considerations we did, a part of the design discussions were, should we display the profile photos against the contacts here, what is typical with most of the user experiences you have. And that was, discarded for this iteration because we're not at the point where we can process the images. But yeah, you can imagine a bit of sync will be involved, but the load time for the app when you're using the experience, not so much, because this is loaded at the point where you need it.
And along the same lines, Pawan asks, I'm curious to know how much load it will add to the CHT as we are using it as offline first. Nitin sends his thanks. This is fantastic.
Yeah, I think it's the same question, and perhaps we can
do
some extended test and see how that measures in
Okay.
comparison.
Yeah.
But I don't have the number right now.
Yeah, for sure. Just from a logistics perspective, you can imagine the CHW is going to have to synchronize the photos up to the server. Anyone else who's getting those same records will have to also synchronize the photos back down. And then there's the client device who will have to render the photos on screen. I think the hard part will be sending it to the server and back. As far as the increase in data is going to go up dramatically, sending the binary data. All right, sounds like there's a lot of excitement around this feature. Very neat to see. Any last questions before we move on to the next topic?
Yes, Gilbert's hand is up.
Oh, thank you. Gilbert, go ahead.
Hi, everyone. Here is Gilbert from Muso. So I have a question. I don't know if I got everything right, but I know that in CHT we already have a photo of image or image feature. So I want to know the difference with what have been done in this project. Is it the same thing or it's something else? Yeah, it's not really clear for me for the moment. Thank you.
Yeah. So I started by prefacing by saying that CHT has had the ability to, it has supported images and attachments for some time now, which is what you're highlighting, that you could previously attach an image to a contact. The part that wasn't supported is routing those attachments to the correct document. In this case, the demo here was creating a household, and the profile photos were attached to each of the household members. Before this feature rolls out, if you were to try this, all of the attachments will end up at the household, and that makes it really hard to support the scenario Antony describing, where you need to sync the attachment data per profile. And the other part to this, obviously, is the ability to show the profile photo, which that's a new feature altogether. I don't know whether that answers the question. Thank you.
That's great.
Awesome.
Maybe
Thanks.
Can I jump in real quick too, actually, because Bernard's mentioned this a couple times, and I just want to make sure that it's sinking in for people as well. This works for the contact flow, like Bernard has demoed here, and it also works on the report side when you are writing a new report. One of the features the CHT has supported for years and years is when you write a new report, you can also have it write other sub-documents as well. So you may have a under 5 assessment form that gets saved, and then as a part of that assessment, you're collecting maybe a parental authorization signature, and you want to save that authorization data off into its own form or its own document in the database, and you want the signature to be routed onto that one. So maybe you're using the draw widget to actually collect an image of that person's signature. Previously, you wouldn't be able to do that. You couldn't store the signature image attachment on the sub document. It would just be attached to the top level, under 5 assessment report. Now, thanks to the changes we've got added in here, you'll be able to basically in your form configuration, wherever you're picking that file, it'll be attached to that sub document there, just maybe like you would normally expect it to work anyways. So that should allow, both on the contact side and on the report side, more fine-grained control of exactly where these attachments go. And then also, just to reiterate too, I see Bishan's question in the chat, does it make any difference to storage? As Bernard has mentioned a couple times, short answer is yes, in that if you are adding attachments, those attachments are included in the storage. However, it's not the attaching the document to the rather adding the attachment to the sub document doesn't make any difference in the amount of storage. We're not duplicating attachments across documents. And so it's the same amount of data that you would store if the attachment was at the top level document, but it's, in this case, you just have more granular control over where it's going. Yuvraj, I see your hand up.
Yeah, it is a follow-up to what Nitin and Pawan has asked here. So does CST provide a way to measure the size of the upload photo? That is my first question, resolution or the image size. And the second one is, when we are showing on the contact or report, and this is related to the sync time and all those things, do we resize it internally, or we just how do we populate that?
So 2 things. In fact, I think one of the improvements that came in with the feature is, I believe we had a limit to the attachment size, and Josh, you can come in here. I forget the details, but I think we had a limit implementation for the reports where you can't upload an image bigger than a given size, and that feature was ported over to the contacts just for uniformity across. So remember, the actual attachment logic existed in the CHT, so that's not changing. Like Josh is saying, you could have uploaded the same images, but they would end up misplaced, and sort of not make sense in a lot of the workflows. In one of the paths, which I believe is reports, we had an implementation to cap how big an image can be, which wasn't in the other path, and that now is uniform across. So that sort of answers the question on what is the limit. The other question you asked is whether this processing, and for this feature, intentionally, we didn't want to complicate it just because of a lot of the other technical issues we had to deal with. And so there isn't processing happening at this stage. It's something that, could be done down the line, but you can imagine the complexity of it, given that the data collection in this case is happening on the app, So the devices we're talking about are the CHT phones, some of which don't have the biggest specs. So even how much you processing and how much resources you can dedicate to that is limited in that regard. So it's a broader feature in itself that was out of scope for this particular version.
Yeah, well put, Bernard. And just one thing also maybe add on top of that. We don't, as Bernard said, we don't have any custom image compression logic that we've added to the contact profile photo workflow, even though that has been something identified as potentially being desirable from a future perspective. The CHT already, though, has some, as Bernard was describing, some built-in boundaries around the file attachments and that kind of stuff. The most relevant and useful here is there's existing logic already when you take a photo in a form. And this is not quite if you upload an existing photo off of the device, but if you're just launching out to your phone's camera, and normally a newer smartphone is a fairly high resolution photo, already by default the CHT does run some compression on that photo so that it's not saving the full size there. And in kind of the original purpose for that was to strike a balance between size and performance versus the losing quality or detail in that photo. I think that there's more that can be pursued there for these profile photos, because there's probably less of a need for high fidelity. We could even do a higher level of compression, but that's something we've kind of got to figure out the customization layer for doing that. On top of all of that too, there is, we run our forms on the ODK and the Enketo system, so it's possible that there is some functionality to play with. Yeah, correct, Bernard, or Binod, that was what as we have this conversation, one of the things I'd like to go test is exactly how much Enketo follows that for uploading a photo. And so there's kind of two different paths that you normally go to get a photo into the form. That is either just using the file upload, or you're launching out to the phone's camera app itself. And so that link from Binod is definitely going to cover the file upload functionality there, where Enketo may have some stuff built in that we are able to take advantage of there. It just kind of depends on whether the version of Enketo we're running respects that max pixels parameter or not. And off the top of my head, I can't say that I've ever tested that. But there's definitely levers to pull here and things to explore in terms of how do we kind of make sure that we're not storing a bunch of high resolution photos everywhere. And then even going forwards, maybe adding something to the CHT web app itself that would help you to crop or compress these photos better, so that we can really have a more streamlined profile capture here. But yeah, like Bernard said, this first MVP of functionality was a massive lift to kind of get the data going to the right place, get the image showing here, start the brain process of figuring out, hey, what is exactly that we need? How can we make this work? So really excited to see this coming through, Bernard, and thank you for all your hard work here.
Yeah, actually, just to respond to Pawan's question, and I can take a few seconds because we have gone beyond the allocated time. In terms of searching for a client, the current health card has a QR code. So it's possible for you just to use that QR code to search for a specific client, provided that information is available in the patient's identifier database, and that's the OpenEMIS database. So they're already using that functionality. And one other option that the team could be able to explore is probably integration with SimPrint, just to identify users using either their face, photos, or such kind of things. So back to you, Ashley. Thank you.
Wonderful. Thank you, Antony. And thanks, Bernard, for the presentation, and Josh for a little more technical details. Sounds like there's a lot of interest in the feature.